the first thing is that I get to have fun at work, and we get to play with children and tell jokes and help them to feel comfortable as they're going off to sleep.
Number one would be the fact that I'm a big kid, so I get to act like a kid for most of the day, which I really enjoy.
Second reason is that we have a huge variety in the kinds of patients that we look after. So one example would be in terms of size. Now I've got a couple of blood pressure cuffs here. This blood pressure cuff is for a tiny baby who might weigh less than a kilo, who's having an operation for a problem with their tummy or a problem with their heart. And at the other extreme, we might have a 16-year-old child who weighs over 100 kilos, who's broken his leg playing rugby, and the blood pressure cuff is huge. So we have to cope with these big differences in size and weight and anatomy, and we need to adapt our equipment to be able to look after tiny babies or big people.
Two would be, I think it takes a certain person to be able to work and sort of give their life to pediatric medicine, and so I think there's a lot of nice people that work here. They're here for the right reasons. It's just a really nice place to work.
The reason is that we look after patients with lots of different kinds of conditions, and I remember the patient which inspired me to do the particular area of paediatric anaesthesia that I'm interested in, which is looking after children who are having heart surgery. And this was a little baby who had a condition called transposition of the great arteries. So that's where the two big blood vessels which come out of the heart are around the wrong way, and when he went into theatre he had very low oxygen levels and his lips were blue, and after he had his surgery and he came out of theatre he had normal oxygen levels and his lips were nice and pink, and I thought that was absolutely fantastic and something I wanted to be involved in.
Three would be peds, I guess kids, kids anaesthesia and paediatric is very grounding. So I guess you come to work and you see kids sick, unwell, you see families struggling, and just puts your life into perspective, and I think you get to enjoy and appreciate what you have. So I think that's something that I find very rewarding.
Fourth reason is that I really enjoy working in teams. So it's not just me who anaesthetises a patient or looks after them while they're asleep. It's a whole team of people, and other people who are in the room, and the surgeon and the nurses who help with all the equipment that the surgeon needs. And each person has special knowledge and special skills which contribute to providing the best care that we can for the children that we look after. And I really enjoy working in a team which is able to provide that kind of care.
And the last thing is that, I think peds, the brief interaction we have with families and the kids is a great moment for us to make them feel as at ease as we can. In various ways, there's many ways we can do that, but I think you get to build rapport with them very quickly, and this is at a moment when they're probably the most stressed they have ever been in their life. So I think I enjoy that facet of anaesthesia probably the most. Yes, that's my 4 reasons.